Hello.
Hello. Welcome back to Expert Instruction, the Teach by Design podcast, where we dive deeper into the research surrounding student behavior by talking with the people implementing these practices, where they work, and with the students they support. I'm Megan Cave.
I'm Danielle Triplett.
Well, Danielle, May is Mental Health Awareness Month,
Yes.
and we have been spending the entire month really exploring what it means to support improved mental health outcomes in our schools.
It's a critical topic. Mental health we're at a crisis point in our country. Like we're seeing that through lots of channels. The data's out there. And so we have a responsibility to respond.
I agree. And like we were just talking about before, mental health and supporting those outcomes for our students is an integrated part of our PBIS framework. The tiered fidelity inventory now includes more explicit definitions of what that looks like within the implementation that you've got going on in your schools and how you can work to improve that work. So that's really important. But I think, too, this idea that the tiered systems that we have in our schools, whether it's PBIS or something else, really are the best way to administer this kind of support to the students and staff and communities in our schools.
Absolutely. The PBIS framework really serves as that backdrop, that foundation for all of
100%.
these systems and practices.
100%.
So.
And as soon as we knew that this was the topic that we wanted to talk about today, Danielle nearly fell out of the chair telling us that we had to reach out to her friend, Dr. Miriam White-Peto.
Yes, we did. And my friend, my neighbor, my colleague, she's just an incredible person.
Yeah.
And I'm glad to know her. So let me tell you about her.
Yeah, tell us about Miriam.
Dr. Miriam White-Peto joins us as our guest today, and she's an assistant clinical professor at the Balmer Institute, which is part of the University of Oregon's campus in Portland. And in that work, she's found her sweet spot. She's really, been there 3 years and found the right role for her, which involves teaching people who work with youth, supporting kiddos in their classroom communities, and supervising undergraduate students. She holds a doctorate in occupational therapy, which really guides a lot of the work she does. And in addition to her work in the healthcare system, Miriam has supported K-12 students at various school districts in Southern California, Oregon, Ghana, and Ecuador. She is deeply passionate about increasing access to high-quality care and improving healthy literacy in youth and families.
Oh my gosh, our conversation with her today was one of those where it was so refreshing.
Yes.
It's incredible to talk to people who are so experienced, so studied, so mindful of the research and the evidence that's out there in their field. But when you talk to them, my God, Miriam was like, it was so easy to talk to her about this stuff. She makes it really accessible, super approachable. One of my biggest takeaways from this was something that she said, which was, I wrote it down so I didn't forget.
I know, we both took lots of notes.
Incredible. I felt like I was in one of her classes.
We were, kind of.
Think we kind of were. She said, you don't have to be a therapist to be therapeutic, which I think really it really elevates the work that we do just as people to support each other. That there are folks out there who have received their training on how to do this and to really like meet someone who has a need, a mental health need, but that all of us can show up for each other as long as we're ready to sit there and listen and see the people that are in front of us for who they are and what they're bringing to the table. So I really loved that. It's something I'll take with me for a while.
I know. That's a great quote. I loved that as well. The other thing that really stuck with me and in my notes that stood out was starting where you are, right? No matter where you are listening out there in the country and thinking, I don't know if my school can do this, but I can do this in my classroom, or I can try this in this smaller group, or, you can do pieces of things. You don't have to say, okay, we don't have a Dr. White-Peto to come join us and do this, so forget about it. That just doesn't work. But we can start where we are and start building that momentum and then find the coalition of the willing and other people that want to join us in that. And that's, I think, a nice way to approach anything that feels daunting in our lives, right? It's like, start where you are, break it into small chunks and make it doable.
Yeah, and
she reminded us of that.
Yeah, and I know that so many of our episodes, we've been really focused on what we can do in classrooms or what each of us can do as adults in a situation. And it can start to feel like, how many hats am I going to wear on a given day? And I also need to teach you how to write that persuasive essay.
Yeah.
And so it feels overwhelming and
Mhm.
insurmountable.
Mhm.
And so that idea of starting where we are is so great. It gives you that liberty to say,
Yeah.
I can't do everything, but I can do this thing
Yep.
in the moment.
Mhm.
And she shared so many great ideas for the things that we can do
Mhm.
right where we are
Yeah.
without too much of an effort.
Nope. So let's listen in. Let's let her shine because she's got so much great information to share us. I think everyone's going to really enjoy listening to this.
Yeah. Cool. Well, Miriam, thanks so much for joining us today on our podcast. Let's see, Danielle, you and Danielle know each other,
We do
right? Pretty well.
very well.
You guys know
We're
each
work
other
friends and friends
from
too.
the
Yes.
when did you first meet Miriam?
Well, that would have been 2022, 3 years
Mhm.
ago in the fall when I had moved back to Portland from Eugene and was spending some time working at the Balmer Institute along with Miriam and like a handful, less than 10 other people at the time. And so she and I got to work very, very closely for about a year together as we were building the team and figuring out how the sort of plans would unfold for the Balmer Institute. It was
Yeah.
very much an iterative process.
It's the best when you get to meet your new colleagues and they're like fun people.
Totally.
Well, tell us a little bit about the work that's happening at the Balmer Institute. What do you do related to mental health and prevention in schools?
Okay. Well, thank you so much for having me.
Yeah.
I'm very happy to be here.
Yeah.
Yeah. Yeah. So to give you just a little bit of context, so the Balmer Institute, as Danielle said, it was launched in 2022, and it was launched to really address three different things. So one was to really support bridging that gap between research and practice.
We love
For
that. We love that
youth
around here. Yeah.
professionals, great. And one of the ways that we have done that is through a micro credential in child behavioral health for existing youth serving professionals. So, in the micro credential, we have students who are taking courses in three areas, and those are how to develop and maintain healthy relationships with children, youth, and families, self regulation. And in that class, students are really beginning to understand the neurobiology and development of self regulation with children and adolescents. And then that third class is on trauma and understanding trauma informed supports and what that can look like more specifically within an educational setting, that really has expanded as the diversity of our cohorts has increased each year as well. So when within each of those three courses, our students are given really specific skills that they can use the very next day in their classes or in their practice areas, and they're provided with opportunities to be able to reflect on those evidence-based techniques that we provide them with. And instructors are able to be thought partners for them within their spaces. And the second arm of Balmer, so there are two other arms, and they're very much integrated with one another. One was to create an undergraduate degree program with the goal of really trying to address the workforce shortage of behavioral health providers. And right now, we know that with behavioral health providers, most people have to go to school for years and years, right, to get a master's degree or a doctoral level degree. And we're just not graduating enough clinicians at that level to meet the ever growing need of children and youth who are in need of mental health services. And so Balmer is really trying to bridge that gap by training undergraduate students in the areas of promotion, prevention, and really understanding behavioral health, as well as providing high quality, evidence based services to children, youth, and families. And so those are the second and third arms of the Balmer Institute. And
Amazing.
so in my role, I am one of the clinical professors there, and I get to support training these undergraduate students by providing direct supervision to them when they're in their internship or practicum placements. I am very involved in the micro credential that I mentioned earlier. And so I get to teach in that program and really provide a lot of support to teachers and community partners. And then I also am placed in a local school a couple of days a week. And within that setting, I get to provide consultation to teachers and staff as needed, coaching for teachers as requested around um, things like sensory processing or behavior management or thinking through different ways to support the diverse learning needs of students in their class. I get to meet with students individually who want to drop in and check in with Miss Miriam for various things. So it could be conflict with peers, conflict with teachers, things that are happening at home. And what I really love about being in this particular school is um, myself and the counselor and those folks who are providing additional support for students are really destigmatized. And what I mean by that is children come in voluntarily and really seek us out to help support problem solving and helping them regulate so that they can go back into the classroom and really support them in developing friendships with schools. And I love that. And then the last thing I do at the school is supporting them around facilitating small groups that are really designed to build specific skills around social, emotional, and behavioral learning.
Right?
It's a great job.
Nobody can see us. My mouth is just like jaw dropped. Okay, that's a lot of stuff, Miriam.
Yes. And it's all new, right? Like they're creating a new
Yeah.
profession. Like
Well, I
there's
was just thinking
amazing.
about that. Like, you're in your previous jobs as an occupational therapist. I am like, could you have imagined that this is what you would be doing? That this was like that you would be training professionals and students to go out and do this work in schools as their job?
Yeah, I just really appreciated that reflection. And I did not. Yeah, I never thought I would be here. And I think one of the things that really pushed me into this role was becoming a mom.
Mm.
Mm.
And I became a mom kind of at the height of the pandemic and was able to be home with my baby for a really long time. And I came back to work and I felt like the need had increased so much, right? Because especially here in Oregon, things were shut down for a long period of time.
Mhm.
And I had families who said, "Oh, we've been waiting 6 months to come see you." And then I knew that they would be waiting another 6 months to get in for ongoing therapy. And I said, that's a year. And when we're especially talking about littles, right, kids, that's a huge amount of development and just been going on. And by the time families think to ask for a referral, we know that there's a lot happening for them beforehand. And at work, I just felt really, I think I felt defeated and discouraged by the systems that were impacting access to services and the lack of flexibility and being able to meet families where they are in a different way. And when I heard about Balmer, I said, this is amazing.
Yeah.
Able to train people in a shorter amount of time to do like a small aspect, right, of what my professional license is and to be at the ground level. Um, I have to do.
Yeah, like why wouldn't you? You know, you have access to people who are actively working with students in schools, and you have the capacity to give them the skills that they need that they can immediately take
Mhm.
after they attend a class. They can immediately take those skills back to their students and then ask you questions about like, well, I did this and this is what happened. How do I respond to that?
Mhm.
Like the access that these educators have to you is incredible. And
Mhm.
therefore, the access that these students have to the mental health support that they need is
Mhm.
phenomenal. Like what a cool job you have, you know?
Yeah.
Yeah.
We've
So,
talked a lot this year and last year too about some of the myths that are out there related to the framework that we support here or just the work that happens in schools in general related to behavior.
Mhm.
And as Danielle and I were talking about mental health and social emotional learning and behavioral supports and preparing for this episode with you, we came across the idea that the work that you do could be controversial.
Mhm.
And we were
Mhm.
like, we were unaware. We had
Right.
no idea that this was something that people would turn, that there would be a sector of folks who would think that the support that you're offering or that their teachers are offering or related to mental health could be a controversial topic. So there are critics out there who would say that the services and the support that you're offering to students is that shouldn't be in schools. So what would you say to that?
Okay. So I teach, right, as part of my job.
Mhm.
So before I answer that question, I think I would just love to propose a question to you two.
Okay.
Ooh.
Turning the
I
tables.
like this.
Okay.
Okay.
I love it. I love it. Okay, so my question is, if we think about a room of 25 students. I know Danielle, you have had experience as a teacher, right? So we've got 25 students. In that room of 25 students, how many do you think will have a mental disorder that significantly impacts their life? Right? Do you think that could be 1 in 25, 3 in 25, 5 in 25? What number stands out to you? Or what do you think? Maybe I didn't offer a number that you
Maybe.
think is a
What do you think, Danielle? I'm
I
thinking
think it's really high.
you do.
I was thinking like go ahead.
I was thinking like like 20 to 25%.
20%.
So like 5 to 6 students. Is that what that would be?
Uh,
20% would be divide by 5. So like
about 5 kiddos
5
out of
to
25
7, 5
your
to
class.
7 maybe.
Are you thinking I need more information. Are we thinking of the kids' whole K through 12 time?
Yeah, we are.
Okay, because that changes it. If I'm like, oh, just well, my daughter, let's say, is in 6th grade,
Mhm.
maybe not, but her,
Uh-huh.
that times all the kids,
What do you
I
think?
think it's like most of them. I'd say
You think so?
we'll have something out of that time.
Yeah.
I think the way that things are too with just it's at a crisis level in
It
our
is.
country. So, and I think, does it get diagnosed? Does it maybe
Mhm.
do we catch it, or is it just still happening? And maybe if I'm looking at nationally,
Yeah.
not just where my kid goes to school or where where we live, but like
Yeah.
in the United States,
Yeah.
I don't want it to be that high. I think there needs more promotion and prevention, but
Miriam, what is it?
yeah. So
What's
tell us, Miriam.
So you'll both bring up some really excellent points. So Megan said 5 and 25, right? And so that's the number that we're working with.
Mhm.
I think I may have set you up a little bit. So when we're thinking about that, we're thinking about a disorder that is going to significantly impact their life.
Mm.
So the data shows and research shows us that approximately 1 in 5 children in the US will have a mental disorder that impacts their life.
It's
Mm.
crazy to me. That's so wild.
So about that number, 1 in 5, um, we can also think about when those disorders begin to show up.
Mhm.
And I think one of the things that's really important for that is for us to know that's not a Danielle, I love that you said, okay, I'm thinking about my daughter, I'm thinking about their class. It's not a like problem over there,
Yeah.
right? It's a problem with other people, but it is a problem that we probably have experience with, or people in our lives where
Mhm.
that holds true for them, right? So it's very much like our problem, right? Our
Yeah.
community, kids, our niece, our nephew, the students that we're working with. Uh, and we know that some of the more common disorders we may see, such as anxiety or ADHD, are showing up early.
Yeah.
That's real. So, for example, 50%, right? So, 50% of anxiety disorders are evident by age 6.
Wow.
And that's the end of kindergarten, right?
Yeah.
So, 50%. And the median age when we think about ADHD and other behavioral disorders is 11. And some of the research that SAMHSA, so the Substance Abuse and Mental Health Administration, came out with reported that in 2019, among the 3.8 million adolescents between the ages of 12 and 17 who reported a major depressive episode in the past year, that only about 60%, or nearly 60%, excuse me, did not receive any type of treatment.
Mm.
So that's a significant number of students and children, youth, and adolescents who are reporting, I need help, but then are not having access to those services. Right? So coming back to the original question of critics say that the services shouldn't be in schools, I would say that based on the data and the research, this is an argument of why this work is so important and can very much be embedded within the school system.
Yeah, Danielle and I
that.
have talked about like over the past, I don't know, several episodes that we've done together, the ways that we have heard our guests describe schools more as community centers,
Mhm.
rather than simply kids showing up to learn.
Mhm.
They're getting all kinds of resources at school
Mhm.
because that's where they spend their time. And it makes a lot of sense to me that the work that you do, that the Balmer Institute has prioritized, that other professionals across the country are trying to do this stuff in schools makes so much sense to me because that's
Mhm.
where kids are.
Yep.
And if you can offer those services in the school where these kids are every day, then they don't have to go an extra place because that
Mhm.
might be a step too far,
Mhm.
right? Like getting, and even like you said, knowing what resources are even available within your community and can you actually access them quickly
Mhm.
is maybe not, they're not always,
Mhm.
you have to get on a wait list. I was just
Right.
talking to a pediatrician about some of these things, and she was like, if any kid needs to go see a counselor or seek some therapy, like before you even know more about it, just start calling these places,
Yeah.
find your insurance, ask them these questions and get on the wait list because it could be, like you were saying, a year before you're even seen. And
Mhm.
by then, what has happened
Yep.
to the actual support that they needed has exploded and now
Mhm.
it's become
Mhm.
so much bigger.
Mhm.
And one of the things that I would point out to you, Megan, is at schools, right? Such a big part of those schools are the relationships,
Yeah.
right? The
For
relationships
sure.
Mhm.
uh, with teachers, with students, with staff. And in those youth facing roles, we have an opportunity to really become expert noticers, right? Especially if we have relationships with students. And as we notice, we can begin to engage in those conversations and early and be a broker of services, so to
Mhm.
speak,
Mhm.
helping to get students connected with services early. Um, One of the things that I like to tell my graduate students is you don't have to be a therapist to be therapeutic, right? So, as we're engaging in these relationships with students and allowing them to bring their full selves to the table, right, and all of their identities, um, we see that they're more open to having conversations and we can then know where to refer. We have more leverage, or I would say trust
Mhm.
and transparency in those relationships to be able to ask some of those critical questions
Mhm.
and help kids get connected with services much earlier,
Mhm.
and really provide more of that early intervention.
Mhm.
Uh, and yeah, we're a huge advocate for early intervention
Yeah.
because of what the research tells us about the potential severity of mental health disorders that are not treated early.
Mhm.
Uh, how students are at greater risk of developing additional disorders if left untreated. Yeah.
Yeah. This is exciting to me to hear you talk about this, Miriam. But I also think, I've been in education. This is my 20th anniversary. So I started teaching in 2005. But I have seen this both with the work I do with classrooms all over the country, as well as my own daughter who's in middle school and her group of friends, where I feel like there's a shift that's happened where being able to talk about these things has been normalized in a way that it certainly wasn't when I started teaching or even when I was in middle school, or that like talking about anxiety, accessing services, being in therapy, going to the counselor. Like, I know our next question is about the positive outcomes, but
Yeah.
for me, that's something I've seen even at the short time I was at Balmer and just in the experience I've had is that in schools that are doing this well, and again, kind of creating spaces that do feel welcoming for our kiddos, they are normalizing just the discussion around mental health and doing things that are more preventative. I'll hear even my daughter, her friends will talk about these things, and it's really encouraging. I know that's not the case everywhere, but I'm curious to hear, your take on that and this kind of normalization of the discussion, as well as other positive outcomes you've experienced in this work and that you've seen with the schools you're working with.
Absolutely. I love how you describe that, just normalizing mental health and mental
Right.
well-being. I have a 4-year-old, and we have really been working hard on normalizing that we all have different brains, right? We all have different ways of learning and growing and thinking. And she comes to me, she's like, Mom, I've got my solution brain ready. I still
Aw, I love
to think about different things, and has also been really open to having conversations. And like I'm seeing this in the preschool as well, of normalizing all emotions and feelings are okay, but all behaviors are not. Right. So
Mhm.
even when we're sitting in the discomfort of frustration or grief or sadness, that's okay. That's totally okay, and I think part of that comes with strong, social emotional learning curriculums, and then teaching students, "Okay, what do I do, that
Mhm.
can be helpful and productive, versus, some more of those maladaptive behaviors, that students, may have, adapted." And so going back to your question about what are some of the positive outcomes that I've
Yeah.
experienced in this work, I see that students are improving, which is really exciting. And the way that I say it, the reason I know students are improving is because we've been working with students, or excuse me, with teachers and staff on really understanding like what are tiered systems of support, right? And then how do we use data to make informed decisions? And one of the ways that we've done in the school that I'm supporting is through universal screening,
Mhm.
wherein we're screening all students in the school and are able to take that data and really analyze it. Right. So, some of the questions that we're asking are where are their greatest areas of need? Right. Do we see that within the entire school? Do we see that within a specific grade? Do we see it with one teacher? And then, how do we allocate resources to support based off of that? And then where do we need to provide additional supports to students, whether that's through small group instruction or more individual interventions? And so, with that, we have a very clear pathway for where students will be going based off of the data that we're receiving from those screeners. And I'm really fortunate that I'm in a school that is screening multiple times throughout the year. So we have data points at the fall, we have data points in winter. And again, we're really able to look at that very thoughtfully as we provide additional supports for staff as well as our students.
Mhm.
And what I've loved seeing is shifts in the numbers and seeing like new acquisition of skills, seeing a decrease in the amount of referrals that students may be having, an increase in attendance. And that can be just students staying in the class for longer periods of time. So those are some of the really positive outcomes that I've seen and experienced. And this is more anecdotal, but I live in the community with the student or with the school that I'm with. And it has been really fun to see kids in the communities with their families
Mhm.
and for them to be excited to introduce me to their parent and talk about just totally unprompted. This is our school and in my class, and these are the things that we're learning. This is the thing that we're learning in group. And so much of that is around understanding regulation,
Mhm.
understanding like how do I make decisions that are going to help me meet just like short-term goals that I have. How do I handle conflict with peers, or how do I solve problems that seem really challenging for me? And then how do I use different tools to support me in being able to be a strong student? And that's been really exciting.
Have you, what have your, I guess it would be the micro credential students that you're working with? What has their experience been applying the skills that they've learned and the improvements that they've seen? How has it affected their um, outlook on teaching?
Okay, I love that you brought that up. Thank you so much for reminding me of that. That actually, a few weeks ago, I was able to meet with micro credential students from the past 3 years that I've been teaching.
Oh,
So
I bet that was great.
it was
Yeah.
it was so great, and I didn't know that I would see everyone at this event, and I was blown away at what they are doing now and how they have taken the skills that they've learned and just run with it in their settings. Some have changed their practices in the ways in which they are setting up their classrooms.
Mhm.
Um, my students, excuse me, are not just teaching in traditional K through 12 settings, but some are in hospitals, some are supporting transitions. And so that has been a really big thing of, excuse me, helping to normalize the experience that students may have while they're in a hospital setting, and really being able to prioritize those students' mental health prior to getting into academics. I had another student who held a forum recently with many other schools and early childhood providers using the materials and readings that we had in one of the classes. Then I was super excited to hear that because we would do brown bag trials in school or in class, right, where they would spend some time practicing. Okay, how might you share this information with your peer? And I had a student who did that and then just really expanded her outreach. And then another student who I worked with a lot this year, she brought her district administrator over to meet me. She's like, "This is my teacher,
Yay.
Dr. Muse." She's this particular student and just named all the ways in which that student has shown growth, and most of it due to her own changes in pedagogy and how she has her capacity for empathy has really grown based off of what we've talked about in terms of stress or trauma and attachment systems, predictability and routines. And so just her being able to set up her classroom differently has supported the students' growth exponentially.
Let's switch gears and talk about some of the challenges because this is not easy work. And I think schools, especially, like we were talking about this, but there's so much on educators'
Yeah.
plates, right? I mean, we just can't keep adding and doing this. It's not sustainable. It doesn't work. We're burnout's high. People are leaving the profession. So tell us from your point of view, what are some of the biggest challenges you've seen in the schools you're working with regarding mental health in general?
Okay.
Yeah.
So I some of the things you talked about in terms of high workload for teachers and teachers being burnt out, that's one of the things that comes up quite a bit in our class discussions. And then some other things that come up in what the literature is saying is there are significant limited resources, right? So I would say like resources is one of the biggest things, and then the need, right? So we have a need that is outpacing the availability of qualified providers who are going to provide like high quality evidence based support to our students, right? Because we know that if we are providing services and support but are not effective, then students will not get better. So those are some of the biggest challenges
Mhm.
that I think schools are facing from a mental health perspective. And then there's diversity in terms of the types of of presentations, right, that we'll see and the different types of disorders that students may present with as well.
Like, when you say diversity of it and that's a challenge, is that just do you just mean that, like, it looks different for different students and that recognizing what that could be may not
Mm.
may not come as easily when if you don't recognize that it's presenting
Right.
differently?
Absolutely.
Mhm. Yeah.
And so often, um, we are reliant on teacher observations
Yeah. Mhm.
and self-reports by students.
Mhm.
There are well, there's a lack of really comprehensive and robust ways, excuse me, to identify problems early,
Yeah.
which is where screening can be so very helpful,
Mhm.
right, to address that challenge. And really, if we think about addressing our students' mental health through some of that tiered support, we can think about from that universal standpoint, making sure students have like everyone, right, regardless
Mhm.
of their um, have access to screening, number one, where we're able to really identify risk and mental health risk. And then, based off of that, have a very clear pathway of what to do with that information, right? So, how can teams really triage and provide
Mhm.
support for students who have increased risk, whether that's through small group instruction or more individualized and intensive supports? Mhm.
So you mentioned obviously just now screening as a thing that schools can do to that work generally across contexts and demographics. What are some of the other things that schools can do or may already be doing that they don't realize actually support
Mm.
improved mental health outcomes for their students?
I love how you phrase that. Like, what can they do or aren't they already doing?
Mhm.
And I would go back to Danielle's comment about um, things being, I don't remember how you phrased it, Danielle, so I'm going to paraphrase a little bit, but really, how do we destigmatize
Yeah.
mental health, right?
Mhm.
That they're
Totally.
just, right, to talking about those things. And so with that, I just say keep doing that.
Yeah.
And there's a significant body of research that really supports increasing students' mental health literacy. And I think that's what you're probably seeing
Uh,
uh, with your daughter's
Mhm.
school. And so that means we're delivering classroom based mental health education that's really designed to help develop and maintain positive mental health. It's addressing ways to reduce stigma that you talked about,
Oh, yeah.
being able to express distress or having mental illness. We're teaching students how to effectively engage in help seeking behaviors. So for the ad, it means like when do they seek support and where can they go? And so those connections and relationships that we talked about earlier are so very critical to that component of our mental health literacy. And then how do we support um, students in being able to identify what some of their options are, right? So, again, we're talking about the school being a hub
mhm.
for resources. And then, as expert noticers, we're helping to plug kids in to different services. So, that would be one, right? So, mental health literacy. Oh, look at that fun thumbs up there. Uh, and then promotion of social, emotional, and behavioral learning. Right? So, again, I go back to the research. It tells us over and over again that when we're thinking about education and education that really promotes social, emotional learning, will yield so many positive outcomes for students, for the adults in the building, and the school community. So I think that would be tip number 2.
Mhm.
And with that, we are really supporting kiddos in developing healthy identities, by being able to understand their own emotions and their thoughts and how all of that influences the things that we do, so our actions. How do we manage emotions in different contexts? How do we manage some of those bigger feelings that we're having? How do we feel and show empathy for others in our class? There's a focus on supporting positive relationships. How do we develop those and really maintain those? And then we're also thinking about responsible decision making and how do we care for those in our community?
I'm a big fan of being able to put words to things. And so this idea of like helping kids or youth or any one of us, really,
Yes.
all of us, name a thing
Mhm.
is like, it's so powerful because until then you're just sitting with the emotion or the
Mhm.
thought and
Mhm.
you wonder, does anybody ever feel like this? Like,
Right.
I'm probably the only person that's ever felt like this in the history of time. And so I'm probably
Yes.
just not going to say anything. But as
Mhm.
soon as you know that it has a name, you know that there's
Yes.
somebody else out there who understands it and has experienced it. And so not only would the naming of it be helpful to me as the person experiencing it, but I think it's also helpful for my friends to be able to know what that is,
Mhm.
so that if I am to name the thing, they are aware of what that name is and they can support me. Just like you were talking about with your daughter, that there's an awareness
Mhm.
about
Mhm.
the fact that there are people in the world that are experiencing these things. And it
Mhm.
may not be you, but it helps to know that other people are.
Yes,
Yeah.
totally.
Yeah.
It also helps. I know Miriam brought this up earlier, but that I think in our society, sometimes we're taught, whether that's overtly or just covert messages, that there are good emotions and bad emotions.
Yeah.
Like there's this like these ones are good and you want to
And I
feel
think
happy or you want to have these.
and
But
it
feeling
and
these are
different
that's shameful. That's bad.
different too, depending on your
Mhm.
identity, right? Like,
Totally.
I can't feel
Mhm.
this as a mom, or I
Right.
can't feel this as a woman, or my husband can't feel this as a man, or if he does, like, don't talk
Mhm.
about it. Like,
Mhm.
based on identities, there are certain feelings that are acceptable and not
Yeah.
acceptable,
Yeah.
right? Yeah.
Yeah, identity, culture, right?
Yeah.
And the values that we're raised with. We had a conversation this week with a student who was just like, look at my face. Do you see what's happening here? And so right now I'm pointing at my eyebrows
Yeah.
and what's happening with my eyes. And
Yeah.
a beautiful moment to say, I think you're feeling sad. That's what's happening, right? You have feelings of sadness. And then, when we're learning more about the context, that makes sense. And that could be a hard feeling to have.
Mhm.
But I think what you're saying is, I feel sad.
Mm.
And so
Mhm.
to real time support students and being able to name,
Yeah.
this is what I'm feeling. And these are
Mhm.
things I can do to help me as I like ride this emotional tunnel.
Yeah.
Mhm.
It's so big.
I'm so excited that this generation of young people though are growing up with this. Like I'm a positive Patty. I like that, but I want that trajectory because I didn't have that as a kid.
Me neither.
I had snippets of it. I had Mr. Rogers, or I'd have these things, but in general, no, it was not part of the curriculum in school.
No,
So
certainly not in school. No.
yeah, not yeah.
What a
So
gift,
yes,
Miriam. What a gift.
agreed.
Oh, it's fun. And I think I would say like the last thing I would add is as we're talking about, oh, I didn't have that in school, is building that capacity in teachers,
Hmm.
right? Are wanting to I think about things as a parallel process, right? So if we're wanting our students to really be able to have those skills, that needs to be something that I have as well and can explicitly teach. I can model for them, and then we have opportunities to practice
Yes.
some of those skills as well, whether it's
Hmm.
like feelings or pausing.
Hmm.
We're thinking, okay, how do we work through this? What are you feeling? What are some things that we could do differently next time?
Right.
So just using all of those opportunities as a platform for learning.
Hmm.
Tell that students like it's not our responsibility just to teach academics, but we're also supporting them as full humans,
Hmm.
right? And sustaining their emotional well-being, supporting them in that social development as well.
Hmm.
So where do they start? If my school doesn't have you, they don't. They don't have you to come in and to do all the good things, Miriam. So what do they do? Where do they start? They've got all these practices that you just taught us about and saying like, make sure that your schools are doing this. But you also just now talked about, adults being able to have the capacity to teach these things. And so if I don't have access to someone like you and haven't received the training from someone like you, then where do I start? What do I do?
Yeah, I think, I have students who are asking the same questions in
Mhm.
the micro.
Mhm.
And things that I tell them before I provide them with resources. One, start from where you are. And I think it can sometimes feel overwhelming when we see the need and the lack of resources and trying to figure out how do we bridge that gap. And then number two, one of the things that I start my classes with is a quote. And the quote, it's really great when you have a visual, but it's the larger the island of knowledge, the longer the shoreline of wonder.
Ooh.
Yeah. What we talk about is like as we begin to know more, um, that shoreline of wonder is going to grow, right? As they step into those waters of like the sea of mystery. That's what I most
Mm. I love these
but
metaphors. Oh my God, me
that's
too.
great. I just like, sometimes when we learn this, it can feel like what we're asking you to do is insurmountable. But I want you to know and go back to as my knowledge increases, so do my questions. And that's a good thing, right? That's a
Mhm.
great thing. So I love research and I loved space strategies because I know that they're going to be effective and supportive to me as a youth serving professional. Um, so some of the resources that I really love to share with students and then pull a lot of my resources from teaching as well are What Works Clearinghouse. Am I allowed to share specific?
Oh, yes. And we're big fans of the What Works House. I think, yeah,
Yes,
a
I
lot of
love What Works.
our work through the center and is part of that. Yep.
I love the work that you all are doing through the center. And so that is something that I refer students to time and time again. There are wonderful, like free resources. Again, with the National Center for School Mental Health,
Mhm.
schoolsafety.gov, and then through SAMHSA as well. And SAMHSA would be the Substance Abuse and Mental Health Services Administration. And what I appreciate about all of these resources is they provide a really systematic way of being able to really assess where your school is and then identify what next steps are for you. And I think that can be helpful for me. My students have found it helpful for them as well, so that they don't have to come up with all of these ideas on their own,
Mhm.
but can really say, okay, what do we have in place, right? And celebrate that.
Yes.
Next steps that we can take based off of the resources that we have. And it's okay to start small. And it's
Mhm.
okay if I don't want to say I'm just working on my classroom because that is very important. And it is okay if my focus right now is on like one grade or within my professional learning community before we move to things that are more school wide as well. And I think having leadership be supportive as well is a
Mhm.
huge part of moving this work forward. And what I have seen though, like when we have both the grassroots, so right, so our teachers and staff that are really pushing the work, and we have our admin who are also supporting, then like what is it? The phrase like you're really cooking with grease, right?
Mhm.
Go to it. Go faster, right?
Yeah.
And we have systems in place that are supporting versus people.
Mhm. Mhm. And the kids in our schools pick up on that. I think they're savvy and they know like, oh, the teachers want this, the leaders are on board. Like that creates something in the
Mhm.
school that I think it's just they feel it, right? They're like, oh, they want to do this. They're invested. Yeah.
Mm,
Trust those kids will talk.
They'll say.
Bring pizza.
They're
They'll
gonna
show up.
say. I think the thing that is gonna resonate with me for a while on this episode is when you said you don't have to be a therapist to be
I
therapeutic.
love that.
So this idea that we maybe don't have the level of training that you or your students have, but there are skill sets that each of us bring to every situation that can help someone in some way um, manage or support the thing that they're going through. So this idea of like start where you are and know that whatever you're doing is, you're trying your best and
mm,
and we're all in this to get kids the support that they need.
Right.
Yeah.
yeah. Um, and to piggyback off of that, Megan, I think just being an attuned presence, we so quite powerful, and supporting that relationship, and for students to know, like, I'm seen,
Yeah.
I'm valued,
Yeah.
I'm
Mm-hmm.
mhm,
Mm-hmm.
Which is such a human need all of us have, right?
Literally.
Like
Yeah.
that's it. Me
Yeah.
seen, heard, listened to, and understood. I mean, that's
Yeah.
in my fullness, right? So
yeah.
that having any aspect of our identity behind.
Right. Yeah, your authentic self. Mm-hmm.
100%.
Here for it.
Thank you so much, Miriam,
Yes.
for spending this hour with us and sharing all of your experiences. They are vast and important, and we look forward to hearing about all the wonderful things you and your students do in the future. Thanks so
Thank you for
much.
It was a blast.
Yay. Thanks, Miriam.